Hi, my name is Allison Robbins. I'm a physical therapist at the Ear, Nose, and Throat Institute. I have been a practicing physical therapist for 18 years.
And my name's Jennifer Harrell. I'm also a physical therapist. I've been practicing for 23 years, and I've been at the ENT Institute for 4 years.
Today, we're going to talk about vertigo. How do you know you have vertigo? What is vertigo? What do we do about it? How do we fix it? And what not to do?
So, some of the things that would let you know you're having vertigo symptoms or dizziness, you may feel spinning sensation. You may feel unsteady on your feet. You may feel like you have a floating sensation.
You may have motion sensitivity, wooziness, lightheadedness, or sometimes even a visual sensitivity.
All of these things are different ways that people feel dizziness. So, how do you know what that means? How do you know what to do about it?
You know, everybody knows somebody that has had dizziness. Everybody. We know our mother had it, or a neighbor had it, or a friend had it. And, not everybody knows that there's something that could be done about it, what to do about it, how do you fix it, or that anything can be done about it. Um, you know, there's a lot that could be done about dizziness, but the first thing that has to be done is you have to find out what causes the dizziness.
Just because something helped for your mother's neighbor's cousin doesn't mean it's the right thing for you. One thing does not fix all types of dizziness, and not all types of dizziness are the same. Everyone's different. It's important to get that testing so that we can tell, why are you dizzy? What's causing this? And then we know what to do about it. And there are many, many solutions for the different types of dizziness.
And the biggest thing, do not use Dr. Google. Dr. Google is not your friend when it comes to looking up this information. A lot of people go online and they look up, what do I do when I'm dizzy? And doing the wrong thing can actually hurt you. It doesn't help when you're doing an incorrect maneuver or an incorrect treatment for the wrong thing. It is so important to find out why you're dizzy. And at the ENT Institute, we have a special team of people who know and understand dizziness. This is what we do for a living. You go to a specialist for a reason because they're the specialists. They're the ones that know. We have a group of doctors who know and understand, and we have a group of physical therapists and audiologists who know and understand, and we work together as a team to figure out what's going on so that you can feel better, which is ultimately the goal.
That's right. In fact, just yesterday, I had a patient to tell me he was at the dentist and they didn't have to change how they work on his teeth. They could actually lie him back all the way because he's no longer feeling that severe dizziness. And the dentist was so surprised. Someone else in the dentist office said, "Oh my gosh, I have vertigo. What did you do? What did you do to fix it? Did you do one of those maneuvers?" And he said, "No, I went to the ENT Institute and I've been seeing physical therapy for my dizziness. You should go." And the person said, "Oh, I just want to do one thing and fix it and be done with it. I don't want to have to go for appointments." And he explained, "You don't understand. This is different. This is what you need to do." And so all of our patients become our ambassadors, and they go forth and tell others what they need to do properly to fix vertigo, to try to dispel some of these Dr. Google fixes or your mother's cousin's neighbor, those kind of fixes.
Yeah, there's not one quick fix, unfortunately. We have patients all the time that want that quick fix or the one-time treatment. All you have to do is that maneuver. You can fix me. But that isn't the case. That doesn't happen all the time. Sometimes it does. Sometimes that is all it takes. But you have to have the right equipment and the right knowledge to understand why the problem's there so that you can fix the problem. One thing that people like to Google is something called the Epley maneuver. The Epley maneuver it's called a cannula repositioning maneuver. So what is this and why do people do this? Inside your ear, in your inner ear, so beyond your outer and middle ear, you have something called your inner ear. In that structure, there are these little otoliths. If you Google it, It most of the time it comes up with crystals. The actual term is otoliths. So oto is ear, lith is stone. There are these tiny little stones in your inner ear, and they have a purpose. They're supposed to be there to tell your body a sense of gravity, acceleration, and deceleration. But sometimes they go rogue and they get into places that they shouldn't be. When they're in those places and you change positions, they can cause a spinning sensation or vertigo. Now, in each of these ears, you have 3 semicircular canals, your anterior, posterior, and horizontal. The most common place for the otolith to go when it goes rogue is into that posterior canal, which can be fixed with the Epley maneuver. However, without the right technology to find out, you're not going to know which canal that problem's in. It can be in the horizontal or the anterior. And sometimes even in the posterior, it can be a little more challenging to fix. Also, if you don't do the Epley maneuver correctly, or some of these other wonderful maneuvers that you can Dr. Google, they can cause problems to get stuck in places or get into a different canal or get into harder places that make a professional like Jennifer and I have a harder time fixing the issue. So my recommendation is if you have dizziness, you need to see a skilled professional who knows and understands how to find out what the problem is. There are different maneuvers that can be done if it's not, and then sometimes it's not an otolith at all that's causing the problem. Jennifer, let's tell me a little bit about that.
Sure. In fact, just this morning, I had a new patient who said, yeah, I'm here. I have positional vertigo and I need you to do that maneuver and I'll be fixed. And I said, well, it may not actually be that problem. So we need to do some tests and see. This person had already Dr. Googled at home and they said, oh, I did a maneuver and it didn't do anything. It didn't change anything. So maybe I didn't do it right. So I was immediately suspicious that, well, maybe that's not the problem. So with my exam using Fresnel lenses, I was able to see that was not the problem at all. They, in fact, did not have a positional vertigo. What they did have was neuritis. That's an inflammation of the nerve to the inner ear, typically caused when a virus attacks the ear. And it can mimic positional vertigo, but it's not. And until you do the appropriate exam to determine how the eyes are moving and what's going on, you don't know that. So just looking at someone, you can't necessarily tell. You have to have the right equipment to make that assessment. And so then after explaining all this to the person, they felt much better about the situation and realized there's still hope to help them, but it's not a quick fix. It takes a lot of education of our patients to get that point across. It's complicated and it takes some skill to be able to figure that out.
Absolutely. You know, we've had a lot of patients that have come to us that have been to Mayo, Johns Hopkins, Emory, some of the top institutions with amazing physicians and amazing people that really know and understand a lot of complicated things. They went to these places and they didn't get relief. And then they came to our practice and to our physical therapy team, and we found the answers. And we started treating them in a way that was different than other people had treated them. And they got relief. They felt better. Even though they had gone to some of these top institutions in the United States. It's pretty amazing. Tell them about that patient that her father was an ENT that's been dizzy for 30 years. This is an incredible story.
Right. This woman had been dizzy for 30 years. Her dizziness started in her upper 30s, and she went to her father, who was an ear, nose, and throat physician, and he said, you know what, you're just going to have to live with it. She didn't take no for an answer on that, and she kept looking. She went to numerous different physicians, neurologists, other ear, nose, and throat physicians. She talked to her family physician. She was sent to therapy at a number of different places, some of the top institutions in the country, and she got no relief. She was treated for positional vertigo, which she did not have. A number of different types of approaches. Nothing gave her any relief. She came to us late last year, and actually just this week, her dizziness for the first time reached periods of time in her day where it comes down to a 0 of 10. She was operating at an 8 or 9 out of 10 every single day for the greater part of 30 years. And that's pretty severe dizziness. She was unable to do a lot of activities and has missed out on a lot of things in the last 30 years. But little by little, we're chiseling away at that and bringing it down. So she does still have some dizziness, up to a 2 or 3 out of 10 at worst, but a lot of her day is a 0 to 1 of 10 now. And so that's tremendous progress. But if you don't identify the cause and you're treating the wrong thing, you can do it for 30 years and you're never going to get relief. But if you do the right thing, then in a much shorter time period, you can get relief and you can get on with your life. There's no time limit on how long you've been suffering to whether what we do can help you or it can't. That's a perfect testament to that.
Absolutely. And there is no greater satisfaction in life than to be able to help people. I think Jennifer and I are both very similar in this, as we went into this profession because we like to help people. And we have patients come in all the time and they feel miserable. Like, this is not fun. Dizziness is not fun. It's debilitating and it's life controlling. And then they come see us and they start getting relief and they are so appreciative. They feel better. They are so excited to finally find somebody that'll listen, that will take the time and figure out the problem. And then when they start feeling better, they shout it to the rooftops, right? They're going out and telling other people, which is why we get a lot of people to come in and say, hey, I know so-and-so that came to you guys and they were feeling better and I want to feel better too. It's an amazing feeling to help people and to make them feel better. What about that guy with the nail gun situation? So there's things that can create BPPV. A few things that can create BPPV. The benign paroxysmal, those crystals or otoliths coming out of place, is a hit to the head, and a few other things. But this case was very interesting.
So this gentleman came in. He had an eye patch, and so the obvious question is, hey, what happened to your eye? And as it turns out, just several days before, he had been building a deck at his home around the pool, and a nail gun went off and the nail went into his eye. So being the tough guy that he was, he got a washcloth, put the contents of his eye back in, and went to the emergency room to get his eye put back together. Well, in the process of this, with changing his position to do this eye surgery, he started having horrible acute spinning dizziness. I mean, just intense. So not only did he have a nail in his eye that had to be removed, contents of his eye came out, had to be put back in by a surgeon, he was also now spinning dizzy. So one of our physicians called and said, hey, got this guy with a really acute situation, really would like for you to see him today. So I worked this guy into my schedule, did the evaluation, and as it turns out, he had BPPV, but it was in the horizontal canal. It was also stuck to the cupula, which is kind of a little sticky part in the ear, which means in certain positions, he gets intensely dizzy and it worsens the longer he stays there. If you leave the person in that position, it becomes projectile vomiting. It's one of the worst case scenarios. So what you have to do in that situation is try to get the debris, the otolith, off the cupula to then do a maneuver to get it out. Well, in trying to correct this, I was going to have to lie him down hard to his side. As it turns out, the side I needed to lie him down to was the side with the eyeball, and he was not allowed to lie on that side at all because of the healing that was going on for his eye. So I basically had to invent a different maneuver to do to the opposite side, kind of change my way of thinking. Instead of pushing the debris off, I needed to pull it off. So I had to invert the maneuver, do it to the other side, and it was thankfully successful, and his dizziness was gone. And within several weeks, we had helped him recoup the weakness from that. When I say weakness, I don't mean you have ear muscles. Weakness in the ear is weakness in how the ear communicates with the brain, also called a hypofunction. Helped him get over the hypofunction remaining from that positional vertigo, and he became a normal functioning human, finished building his deck, and was no longer dizzy. And thankfully, he also did regain full sight in that eye. That was just a very traumatic situation, but definitely unforgettable.
Definitely unforgettable. And it was an incredible case and such a success story for both his eye and his ear. There's a little bit of everything there.
And I believe, Allison, you've had a number of successful horizontal canal endeavors as well. I can think of one woman in particular who had an unusual cause for her BPPV.
Oh, yes. So this lady was an interesting case. Bless her. She had been to several physical therapists. She had dizziness and spinning sensation. The physical therapist that she had gone to had done the Epley maneuver on her many times, too many times to count. The definition of insanity is to continue to do the same thing and expect different results. So when this did not work, they should not have continued to do it. She came to us and she did have BPPV, benign paroxysmal positional vertigo. But the canals, the 3 semicircular canals, it was not in the posterior canal, which the Epley maneuver fixes. It was in the horizontal canal. The horizontal canal can be a little trickier because you can feel it in a lot of other positions because it's on the plane of your head moving here. And this lady, her particular one was stuck on the cupula as well. And she was so thankful because we didn't just do the Epley maneuver on her. We put our video frontal goggles on her and we found where the problem was. And we were able to do the appropriate maneuver. There are many different maneuvers, and you need to be coming to an expert who knows and understands what those maneuvers are, where the otolith or crystal is in the ear, and how to fix it. So this poor lady, she came in, we did maneuvers to her different than what had been done to her previously, and she started feeling better, and she was so very thankful. And she's like, I'm always going to come to you guys. And again, now, this poor woman also had repeat BPPV. That can happen too. Unfortunately, there are just some special, we call them unicorns, that get to have this experience more than once in their life. And every time she had it after that, she would come straight to us. It wasn't always in the horizontal canal. It could be from one canal to another. And each time we were able to do the appropriate maneuver and we made her feel better. And she was so very thankful to us for that.
So the cause for that particular individual, it was later determined after some blood work by her primary care physician that her vitamin D level was low. Recently, in the past few years, this has been a discovered cause for repeat BPPV, especially in women who are perhaps losing bone stock. When their vitamin D levels go low, they're more likely to drop an otolith into one of those canals. And that's not the case for everyone, but it's important that blood tests are used to figure out levels of vitamin D and to get on the appropriate amount of supplement if that is one of the causes for BPPV. But that was an interesting case. So we oftentimes get the question, can I just take a pill for this? Can I just take some type of medicine that'll fix this? And the answer to that is no. Some of the medicines that are prescribed for dizziness are really more used for intense situations as emergency saves. For example, if someone is completely unable to maintain vertical or stand up or walk because they are so dizzy that they just can't function, then that might be a time where one of those medications is helpful or useful. These medications we're referring to would be meclizine, scopolamine, dramamine, a lot of the enes.
Bonine, depending on how people pronounce it.
Right. So those medications, what they do, they don't fix the problem. They suppress the brain's ability to take information from the ear. So your inner ear information isn't going to be as impactful symptom-wise to your brain. They also make you very sleepy, sometimes so sleepy that you don't care that you're dizzy because you're falling asleep.
Yeah, which is not good. That doesn't fix anything. Medication doesn't fix the problem usually. It can help with those intense situations, but the key is to find out why. And so that's why you need to come to the Ear, Nose, and Throat Institute. We have a team of experts. We have physicians, audiologists, and physical therapists that work together to find out the reason. And why should you come to us, right? Why? Because we know and understand, but also we have the equipment to find out the answers. We use the video Frenzel goggles, also can be called video nystagmography. We have balance technology because your ear controls your balance too. We can get into that another day. But we have technology to find out where the problem is, so you take the guesswork out. It doesn't do any good to treat the wrong thing. Finding out the answers is what you're going to find at the ENT Institute. Jennifer, this has been great. I'm so glad that we got to talk to everyone about vertigo because I think it's something that everyone should know more about.
Most definitely. This has been great. And I know that this probably has raised a lot of questions in your head, and you may have other questions for us. Feel free to comment with your questions, and we'll answer them another day. We can't wait to hear what they are.
Come back and see us.